Okay. Welcome, everyone. Thank you all for joining me. This is an awesome turnout. We actually had sold out of this webinar, so I am very grateful for you all joining live. I will go ahead and share my screen. Okay, welcome. If you are here as a dental professional and you are interested in navigating different office cultures, then you're in the right spot. If you're watching the recording, thank you for tuning in virtually. Um, for those of you that are joining live, just be mindful that this will be recorded and posted on our YouTube channel for you to view at a later time. If you would like to take notes, that's entirely up to you. But again, there will be a recording that you can reference anytime you'd like. If you have never met me, my name is Shelby. I'm the engagement specialist here. I wear many hats, but for the most part, I do onboarding calls. People can book time with me and I can walk you through the platform, questions you have with invoicing, anything like that. So if you are interested in setting up some one-on-one time with me, I will show you the email that you can reference and use to get that link to book some time with me. We also have two customer support agents, and a customer support manager joining us today. They will be taking care of any questions that you have. So if you do have questions throughout the webinar that just come to you and I'm in the middle of talking, please use the chat window. Lucy, our customer support manager, as well as Travia, who is our customer support agent, will be able to answer your questions live. They are joining us today. Thank you so much for doing that. I appreciate it. And if you do have questions that come up and you just didn't think about it to ask in the chat, no worries. Again, I will have an email address at the very end of the webinar that you can use to ask your questions for our customer support agents. All right, all that out of the way. So like I said, today we will be talking about practical strategies to help you seamlessly integrate into any type of dental office so that you can provide excellent patient care while establishing yourself as a reliable, sought-after dental professional. So the topics that we're covering today is why does the office culture matter for temps? Reading the room, what to observe when you arrive, the critical first 15 minutes, adapting your communication style, common dental office culture types, we'll go into that in more detail, what is considered a red flag and what is more of a growing pain, building rapport quickly since this is a temp shift, so it's going to be one shift at a time that you have a chance to build your rapport, leaving that lasting impression so you get that callback, and then we'll do a quick key takeaways at the very end. So why does that office culture matter? Your success depends on a fit. When offices feel that you mesh well with their team, they're more likely to favorite you on our app, rebook you, and refer you to other practices. First impressions, they happen fast. You roughly have that 15 minutes to show an office that you're there to make their day easier, not the opposite. Every shift builds your brand as in you. Each assignment is an opportunity to strengthen your reputation. So adaptability consistently shows that you show up as a top quality performer in our TempStars review system. Let's read the room, what to look for when you arrive. So when you get into the office, you're going to need to take a moment and just do some observing. The pace and the energy of the office. Is the schedule packed back to back, or is there more breathing room in the schedule? Are team members moving quickly and efficiently, or is the vibe a little bit more relaxed? Match your energy to theirs. Don't be the slow person in a fast office or the opposite, the frantic one in a calm practice. Communication styles. Do they use first names or titles? A Dr. Smith versus a Sarah. Are instructions given verbally, written, on a screen? Is there morning huddle culture of some sort? The dress code, be ready in your scrubs at the start of your shift. If there's a specific color of scrubs needed or additional attire, the office will typically communicate that with you prior to your shift, so no need to worry about that. Team dynamics. Who seems to be the go-to person for questions? Is the dentist hands-on or more delegated? How do team members interact with each other? So these are all things that you can kind of observe and see, or you can ask questions to find these questions out. These first 15 minutes is going to set you up for success for your temp shifts. You're going to want to do your introductions. Introduce yourself to the team. Write down any names if you're not good with names. Build that rapport. It's more faster than using someone's name correctly. Your key questions to ask up front. Where do you want me to chart? Who should I ask if I have questions during the day? Any special patients that I should know about prior to getting started? What time is lunch? Where should I take it? And where to find essentials, supply closets, sterilization areas, the break room, restrooms for you and for your patients, emergency kit locations, where to put your personal belongings. All these questions you can ask before starting your shift. Pro tip, asking questions early shows that you're proactive, but asking the same questions at 2 p.m. looks like you weren't paying attention. So if you're not good with remembering things, be sure to have a little notebook, write something down. Adapting your communication style. This is something that I think is really important, so prick your ears up here. Formal environments. Use doctor and their name unless told otherwise. Keep patient conversations professional and clinical. Avoid the casual chat during procedures. The casual environments. It's okay to be personal, but take cues from the team. Some offices love when temps chat with patients, but others prefer quiet efficiency. Again, this is all going to change depending on what office you're at. When to speak up versus when to observe. Take note on this one. Speaking up, patient safety concerns, missing information that you need, clarifying questions, all things that you need to speak up for. Something that you need to just be observant of. You never want to suggest workflow improvements in an office that you're just stepping into for the first time. Commenting on how things are done differently elsewhere. That's not really beneficial. And then the office dynamics and the politics. These are all things just for you to keep note of, but not really for you to talk on. Common office culture types in dental practices. This is a big one too. So different types of environments right when you walk in. And I think a lot of people can feel this when they walk in. You know, when you walk into an office and they're high volume, fast paced, you can feel it. As opposed to walking into something that's more, it says boutique, but I feel like more of like a family practice, more hometown. So high volume, fast pace, expect that quick turnaround, minimal downtime. Efficiency is valued over extended patient education. And be ready to move. Have your instruments prepped, be ready. Here's a tip. Don't take it personally if instructions are brief. Just be adaptable. The boutique or patient focused or the family oriented dentist. They're going to have a longer appointments. They're going to emphasize on the patient experience. They may expect more conversation, build a relationship with the patients, more trusting, quality over quantity. Don't rush things, even if you use up that, if you're used to like a faster pace. This might be difficult for people that are used to like a faster pace environment. You just need to learn to slow down a little bit. And then the team-oriented versus independent. This one's a little unique. So some offices want you to check in frequently, let you know how it's going, what's going on. Others want you just to kind of handle your tasks, do your own thing. Just ask if that's the type. So ask, do you prefer I communicate you throughout the day, or is it something that I can give you a debrief or a follow-up at the end of the shift? Okay, red flags versus growing pains. Let's talk about the growing pains. Your first time in an office, you're temping. These are going to be your growing pains, something that's very normal. You're feeling slightly lost the first hour. This is your first time in this office. It's okay. Not knowing where things are. It's going to take a little bit. Different software than you're used to, and the team members are too busy to chat. These are all things that other offices, they know that you're going to experience that, and that's okay. When it becomes a red flag and it's a little concerning, you're pressured to skip safety protocols. No biological monitoring documentation when asked. Hostile or disrespectful treatment from team members. Being asked to do things outside of your scope of practice. And unsafe working conditions like broken instruments, dull instruments, infection control issues, things like that. So when to address some of these issues. So if it's a patient safety concern, you need to address them immediately with the office manager, your point of contact, the dentist, whichever. Equipment or supply issue, raise it in a professional way and document it if it goes unresolved. And an interpersonal issue. So maybe somebody's being disrespectful, pushy, something like that. So focus on getting through the shift professionally and then contact customer support at the end of your shift. Protecting your boundaries. Be mindful that you do have the option to always leave a shift if you feel like your safety or patient safety is at risk. Be sure if this is the option you're going with that you reach out to TempStars customer support so we can guide you through how to handle that. And then document anything you can so that our support team can investigate concerns with both parties. And then you always want to protect your license and your safety, which always comes first. All right, switching gears, building rapport quickly. Being helpful without overstepping, I think, is a big one. Offer to help with like breakdown, cleanup, anything that you have the downtime you can help with. Ask, is there anything else I can do during downtime, or you're done early with your shift, but you still have that time on the clock. Don't rearrange their supply cabinet or try to improve their system. They have a set way of how they do things, and that's how they do it. Showing initiative appropriately. Again, if you finish early, check in. I'm ready for my next patient. Anything I can do to help in the meantime. Restock your operatory without being asked. It's always great to leave your workspace cleaner and better than how you found it. The power of positivity. A genuine thank you for having me today goes a really long way. Never badmouth other offices you've temped at. It never looks good on anybody. Just always have that positive attitude and outlook. And leaving that lasting impression. It's the end of the shift. Here are some best practices. Ask, is there anything else you need before I go? This, we always like to make sure that they have everything in terms of you receiving your payment. So if they need your email address, your mailing address, your phone number, anything to process payment, just make sure they have everything before you walk out the door. Be sure to thank the dentist and the team for having you. That's always such a nice touch, very personable. And like I said before, leave your station spotless. Following up professionally, you always rate the office and TempStars promptly and fairly. This is not only a good note just for you, but also for other temps that are submitting offers for these offices. If you loved it, just make sure you say that in your review. If you're interested in returning, you can always state, I really enjoyed working here. I'd love to come back anytime you need coverage. And then getting invited back. Offices do have the ability to favorite temps that they want to see again. So make sure you're one of those. Being reliable, adaptable, and positive is going to get you those repeat bookings. And remember, a 5-star rating opens doors to Instabook opportunities. That means that you get in a lot quicker when you submit offers. There's no waiting for that 18-hour window of am I getting accepted or not. It also unlocks, when you become elite and pro, it unlocks higher guaranteed hourly rates. So that's always on the lookout for those awesome reviews. A lot to talk about. I know this was a hot topic. It was a lot to go over. If you took notes, thank you. If not, again, this is recorded. And here are the key takeaways I put on the slide. Makes it quick and easy. First 15 minutes is going to set the tone for the entire day. Introduce yourself. Ask key questions up front and show that you're ready to help. Observe first, adapt second. Read the room before jumping in. Match their pace, communication style, and energy. Flexibility is what's going to get you that 5-star review. Know the difference between your red flags and your growing pains. Feeling lost in the first hour, like I said, completely normal, and they know that. Being asked to skip protocols or work outside your scope, obviously not. Small actions build big reputations. Restock without being asked. Leave your space spotless, and thank the team genuinely before you leave. Every shift builds your brand. Again, reliability, adaptability, positivity. Favorite, ratings, and repeat bookings. It is that simple. Thank you, everyone, for joining. I really appreciate it. Like I said before, I would give you the contact information for you to reach out to customer support if you have struggles at a shift or questions about anything I talked about, you can feel free to reach out to our customer support agents at help@tempstars.com. If you are looking for one-on-one time with me, again, I can walk you through the app. We can do some screen sharing. I can show you some tips and tricks on how to get offers approved, anything. Ask them at help@tempstars.com. Ask them for my calendar link, and they can get that to you, and you can book a time with me anytime you want. I do these webinars once a month. Towards the end of the month is the sweet spot, it seems. If you have any ideas for topics that you would really like to see a webinar built out, please let us know. I love building this material for you all and presenting it in a way that you can connect. But otherwise, I will keep the call open for about 10 minutes. If you all have any questions, you can use the chat if you don't feel like talking or you're not in a space where it's quiet. That's great. You can use that chat, or you can unmute whenever you like and you can ask a question out loud.
Hey Shelby, would you like for me to read the questions from the chat and you answer out loud, or would you prefer me to answer them?
I can answer one of them right now, actually. The one in regards to the ODA members getting points. That is something certainly, Shelby, we can talk about, usually for the ODAA for dental assistants, if they're doing any continuing education courses or a webinar like this, they get a little certificate that says that they were here and they completed it, and they could submit that for points so that they can renew their membership. So great question, Amber, and we'll definitely take that with us, and it is something that we can do.
Awesome. Awesome. I love that. I do see a question, how to get booked easily. So there's a lot of things that go into that. Lucy, Travia, if you guys want to take over and oh, great, Travia answered that. Well,
Yeah.
There you go.
Yeah, she's on it. One of the big things is making sure that your profile is completely filled out. We've done some revamping over the last several months to help our members in regards to putting yourself out there, putting out your credentials, your skills, what you can do, and being able to amplify that on your profile is going to be very helpful, right? So when you're submitting those offers, that is what offices are looking at. So if you work on that, that is one of the big tips for getting those offers looked at and accepted.
And I did host a webinar last year on our enhanced profiles, and it's still up to date. So feel free to go to our YouTube channel if you'd like, TempStars on YouTube. And there is one called Enhanced Profiles, and I walk you through what you should be including in each section, how to set yourself apart from others to get accepted for shifts. But yeah, that's on the YouTube channel. So that's pretty good information there.
Good question about the commonly used softwares for dental offices. Right now, other than that information being provided in the shift details, you're able to see what software each office is using. We are working with our development team to actually add in tutorials for each of those softwares in the app. So if you're applying to a shift, and let's say maybe you're not too familiar with ClearDent, you're going to be able to click on that on a tutorial to actually see what the software is about, learn a little bit about it before you actually accept the shift, and go in knowing a little bit more than actual not knowing anything before you go in to do that shift.
Awesome. Awesome. Great questions, y'all. All right. And if nobody has any other questions, I'll go ahead and call it. But the questions you all asked are awesome. It gives me ideas for future webinars. So thank you for that. But otherwise, like I said, if you didn't have the opportunity to ask your question, or you didn't think about it until after reviewing this recording, always send your questions to help@tempstars.com and we will gladly answer them for you. Thank you, Lucy. Thank you, Travia. I appreciate you all being here and helping out. And thanks everyone for viewing live. This was awesome. Great turnout. I appreciate you. And yeah, and stay tuned. We'll have another one next month. Bye, everyone.
Bye.